Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining us today on the show. Welcome to the show that's designed to change your health for the future. I'm so glad you decided to tune in with us on your Saturday morning because your health is the most important thing that you have. If you lose your health, that means that you can't play with the grandkids, you can't go for walks with your spouse, you can't exercise or even make your house payment or car payment. So your health should be your highest priority above everything else. But most people have a tendency to sort of put their health on the back burner. You know, as Americans, we're so driven to work hard and play hard that a lot of times our health gets sort of pushed into the background. And that can be a very dangerous road to go down because if you lose your health, you may not be able to get it back. And having good health is so critical to everything else you enjoy doing and you have to do in your life that it really should be made a higher priority. And so hopefully this show can encourage you to do that. I'm Dr. Kevin. I'm the Senior Vice President of the Bryant Wellness Institutes. I'm here with my co-host Brandon Coma. Brandon, how are you today, sir?
I'm doing well. Looking forward to another show. You started something new last week. Looking forward to you addressing something similar but in a different area.
Yeah, we're going to hit a little different angle on it today. And for those of you that tuned in last week, you will remember that February is Spinal Health Month at Bryant Wellness. And that means that we're going to spend the next few shows talking about the number one disabling thing in America in people over 50, and that is spinal problems. Spinal problems are the number one disabling thing in America. So even if you don't have any spinal problems right now, there's a chance that you might develop them. And even if you have minor spinal problems that you don't really think is a big deal, these things could get out of control on you very quickly, and you could end up with something really severe down the road. So you really want to pay attention to these structural and spinal problems because, you know, it is one of the most common disabling things that people have. But normally on the show, we come on here and mostly talk about chronic diseases. So for those of you that aren't regular listeners, most of the time we'll come on and talk about things like thyroid and hormones and diabetes and, you know, heart disease and things like that. But today and for the next few shows, we're going to focus on physical, structural, spinal type problems. And then on February the 21st, I'll be hosting a free community workshop called 5 Secrets to Solving Your Pain for Good. And this workshop is for anyone out there with unresolved problems in their structure and in their spine. And I don't care everything from the mildest problem that you don't think is that big of a deal yet to the patient who has been everywhere and feels there's no hope for them, and maybe they've been to specialists. Maybe you've even had surgery and you're still having some problems. No matter how severe or mild it is, this workshop is going to have a section in it that's going to show you a pathway to living a healthier, more pain-free life. Now, on last week's show, we really focused in a lot on the spinal disc. But if you tuned into that show, I also mentioned that I feel that placing so much focus on the spinal disc is sort of outdated technology. All of the new research is going towards function, meaning how the spine and body works when you're up gravity bearing and bending and moving around. And when they do an MRI, think about this. The first thing they tell you is to lay down and not move. So they take gravity out of the picture and they take motion out of the picture. And your spine is designed for 2 things, gravity and motion. So all of the new research showing that function is more important than structure, meaning how does it work when you're up bending and moving around? That's more important. So we do what we call gravity-bearing motion study radiography. So we put those 2 most important elements back into the evaluation process, and that's how we're able to determine problems, even when all of these quote-unquote specialists have either just blamed it or labeled it or something, or maybe not been able to figure it out. So what gravity-bearing motion study radiography means basically is we take x-rays of you standing up and moving and flexing and bending. And that shows more than even what an MRI, because MRI doesn't show movement and it doesn't show gravity bearing. And that's one of the really neat new technologies that we have available to determine what's really going on with the patient that's in pain. And I have patients that have been in pain for years, been to numerous specialists, and no one has ever checked the function of their spine. But function is the most important element whenever it comes to the spine. So why would you want to evaluate the spine laying down and not moving? And I'm not saying that MRI has absolutely no value and there's never a disc problem. Of course there is. But we actually like to do both. We look at the MRI to see the soft tissue, and we look at the gravity-bearing motion study x-rays to see what it's like under gravity and under motion. Then we could get a complete picture of what's actually happening in the patient as they're walking around in their day-to-day activities. And if the spine is not functioning correctly, then you will start to get these other problems and these disc problems that will develop. So function is lost before the disc is lost. So it all goes back to how it functions, and all the new research is backing me up on that. And you know, a bulge or a disc that has herniated or that is bulging. If you've ever pulled your car too far into a curb and your tire bulged out on both sides, what happens when you back your car up? It goes back. So on last week's show, we were talking about this, that function will restore the structure. And if we can restore the function, then the structure sort of takes care of itself. So that was last week's show. And on this week's show, I wanted to switch gears and talk about the next issue that is so prevalent in today's society whenever it comes to spinal problems, and that is arthritis. Now, the problem is that most patients feel like, well, I have arthritis and I'm just doomed to have that. There's nothing I can do about that. I just, have to take something for it every day, and I'm going to keep my arthritis forever. That's no longer true. The truth is there's lots of things we can do to slow down the progression of arthritis. And there's definitely better solutions out there than just to cover it up with Advil or Tylenol, or even some of these more dangerous things like Celebrex or some of these other drugs. That doesn't slow down anything. That doesn't restore any function whatsoever. Now, as far as arthritis goes, I want you to know that there's a lot of interchangeable terms whenever it comes to degeneration of the spine. So all of these things mean the same thing. I don't care if you've been told it was arthritis, spurs, degenerative joint disease, disc degeneration, arthritis. All of those things mean the same thing. It means that you have joints that have deterioration or degeneration in them. Now, guys, here's the big concept that I want you to understand if you have arthritis or spurs or degeneration. Basically, what's happening at the very underlying level of what's going on with arthritis is this: for every year that goes by, that arthritic joint might age 5 years or 10 years. So in 5 years' time, that joint looks 25 years older. Degeneration means that your joints are breaking down faster than you are. So the secret, and remember, the workshop's called 5 Secrets to Solving Your Pain for Good. And one of the secrets whenever it comes to arthritis is that we have to figure out how to get your joints to age at the same rate you are and not faster. So if you age 1 year, that joint ages 1 year, and that's normal. In arthritis and in degeneration and spurring, you age 1 year and that joint might age 5 years or 8 years or 10 years, and that's not okay, especially if you're still a young person. So think about this. If you're in your 60s and you already are developing arthritis, and let's say that that joint is aging 5 years faster than you are. So by the time you're 65 and that joint's aging 5 years faster than you are, that joint will have 25 years worth of degeneration put on it by the time you're 65. So by the time you're 65, if you're 60 and you don't do something about it, by the time you're 65, that joint is going to be completely gone and deteriorated, and you'll be in really severe pain the whole time. So if you're in your 60s, that's not good to have arthritis, because your joints have to last you a long time, another 20 or 30 years at the least. So many people mistakenly think that it's just normal for your body to start to break down in your 60s. And that's not normal. 60s is not the time. If you take care of your joints and you figure out how to restore the function, being 60 does not mean that you should be broken down and hurt and be arthritic. Now, 80s, 85s maybe, but not in your 60s. 60s is still very young. But one of the main reasons that people get arthritis and degeneration so early in life is what I was talking about last week. If I take 10 people off of the street and I say, who's your dentist? All 10 people can name someone. All 10 people have a dentist. But if I take 10 people off the street and I say, who has maintained or taken care of and treated and worked on your spine your whole life and maintained it, no one has done that. But just like your teeth need maintenance, your spine needed maintenance and checkups and treatment your whole life, but that just never happens. For some reason, that got missed, that we taught people that your spine is something that needs to have checkups and taken care of and maintained and treated and balanced your whole life, just like you do your teeth. Then when you add in the fact that the average person has had 1,000 physical traumas to their spine that they have not addressed, things that you didn't think was a big deal at the time, but have added up. And, that's what I've seen year after year in my practice over the last, 20 years now I've been in practice. Most of the time, it's not one big thing that's caused their structure to fail. It's several little things that go all the way back from very early in their life. We can go all the way back to coming through the birth canal. I mean, we can go all the way back to birth. Many times that's our first case of whiplash. And then the average a child falls 200 times learning to walk. And then you have skateboards and bicycles and wrestling and falling out of the treehouse and four-wheeler accidents. I mean, it just goes on and on. And then you have car accidents and lifting groceries and mowing the grass, as we get older. And then by the time you're 40 years old, you've had 1,000 little physical traumas to your spine that were never addressed. So today, I'm going to give you one of the secrets of the 5 secrets to the workshop. And it's going to be dealing with arthritis and degeneration. So this is a free community workshop on February the 21st at 7 p.m. at the Hilton Garden Inn called 5 Secrets to Solving Your Pain for Good. Everyone's invited. And the secret that we're going to be talking about today is what to do about arthritis, degeneration, and spurs. And all that means the same thing. So we're going to discuss that on today's show. And I'm going to give you the secret to how we deal with this in an all-natural way, and we have tremendous results. And one thing's for sure, if all you're doing is covering up your pain from this arthritis, if you're just taking medicine for arthritis and you're not doing something to slow down the progression of it, it's probably going to be twice as bad next year and then 4 or 5 times as bad the year after that. So we need to take a new approach. And I'm going to give you the secret on how to do that right after this short break. But if you want to come to the workshop, you need to call right now and register at 837-7174. It's called 5 Secrets to Solving Your Pain for Good. We have a few seats left. It's going to be February the 21st at the Hilton Garden Inn at 7 p.m. So you can call 837-7174 to reserve your seat. This will be the best workshop on how you can take care of your body for your life and for your future. You can also just text the word pain to 77453 and we'll return your call Monday. That's pain to 77453. And in New Iberia, their number is 367-2567, or you can get both numbers on Facebook. We're going to give you the secret to dealing with arthritis when we get back. Don't go away. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining us again on the show. We're discussing arthritis and degeneration and all manner of structural problems on the show today. And before break, we were saying that basically what arthritis means, what degeneration means, is that aging, for you age 1 year, that joint ages maybe 5 years or 10 years. Arthritis means that your joints are aging faster than you are. And in just a few years' time, that joint can look very deteriorated. So the key, the secret to solving this is to find out why this is happening and how we can reverse it. Now, here's the number one secret when dealing with arthritic type disorders in the spine. And I want you guys to really listen. I want you to really think about this. And here's the secret. Your body and your joints are a mechanical object. So you have hinge joints in your knees, you have ball and socket joints in your shoulders. So your joints are a mechanical object, just like your car has. You know, your car has ball joints in the suspension. It's a lot like your ball joints in your shoulders. So your joints are a mechanical object, just like in your car. Just like your tires, just like the gears on your transmission. A joint is designed to move in a certain plane of motion and a certain degree of motion. So a joint is a mechanical object. Any mechanical object will wear out faster if it's not functioning the way it was designed to function. Think about this. If your tires are even slightly out of balance, they're going to wear out early. Or if the gears in your transmission, if those teeth in your gears of your transmission, if they're not hitting together exactly in the right order, like they're designed to do, your transmission is going to break down and deteriorate early. And this is exactly what is happening on your joints. If your joints aren't functioning correctly, they will break down early. So if you take an arthritic joint, if you take a patient that has arthritis in their body and you back that up 20 years before that, before the arthritis developed, the function was lost at some point and no one fixed it. If your joints aren't functioning correctly, they will break down early, just like your tires or your gears on your transmission or the ball joints on your suspension. The only way to see them function, the only way to see if that function is being lost is to do these gravity-bearing motion study x-rays that we've been talking about. So this brings us full circle to last week's show where we were talking about the MRI, and we said that because the MRI has you lay down and not move, that takes gravity and motion out of the picture, and gravity and motion is key to figuring out function in the joints in the spine. And that's why an MRI is not a good indicator of joint function. So we do this gravity-bearing motion study radiography, and that way we can see the joints functioning, and if they're not functioning in the way they were designed, we can sit down and figure out what we need to do to make that start happening again, because the ones that aren't functioning are going to deteriorate. And you know, you can look at x-rays and see a perfectly healthy vertebrae, and the one right below that might have stage 3 deterioration. Well, why is that? How can you have one perfectly healthy one and the one right below it's in stage 3 degeneration? It looks like an 80-year-old joint and the patient might be 40. How is that? Well, that's because the one that has degenerated was not functioning correctly and no one caught it. No one did anything about it. So remember last week I was talking about all the new research from all the spinal experts is going towards function and away from structure. How does it work? How does it bend and flex and move? And this is the secret to why. Any mechanical object that's out of balance and not functioning the way that it was built or the way that it was designed is going to break down early. And we always ask ourselves, how can I make this joint mechanically better? A mechanical problem needs a mechanical solution. You can't take a mechanical problem, meaning the joint's not working, and cover that up with chemicals and never get it better. You couldn't do that to your car. You couldn't take a tire that was deteriorated and put some chemicals in there and fix it. No, you have to mechanically fix it. And our bodies are exactly the same way. A mechanical problem requires a mechanical solution. So we always ask ourselves, how can I make this joint function mechanically better? Which in turn will improve function, which in turn will reduce the rate of deterioration and also eliminate or reduce pain greatly. So can you see how all of this is much more effective than probably what you've been doing with your joints and with your deterioration that's going on in there? Covering up the pain does nothing to slow the rate of deterioration. In fact, it makes it worse. So what do I mean by that? So how can you taking something to cover up your pain actually make you worse? Well, here's how. Pain is your body's limiting system. So if you bend to the left and that hurts, that's your body saying, don't do that because you're damaging something in there. So when you take something to cover up the pain and you're walking around bending and flexing, you're damaging that worse because that limiting system of your body saying, ouch, don't do that. That damages something in there goes away. So you're actually making it more damaged and more difficult to deal with in the long run. And listen, guys, I know that people turn to medication and they're just trying to improve the quality of their life. And that's very understandable. And I'm not blaming anybody for that. And I understand that sometimes that's necessary. And I realize that these medications may have allowed you to actually live life with a little less suffering. And I won't ever take that away from you. But my point is this, you have to also be trying to restore function. You also need to be doing something to make that joint healthier while you're feeling better. Otherwise, you're just damaging it further. Not to mention the fact that I see patients every day that are severely addicted to these opiates, and many older folks don't even realize that they are. You know, they don't realize that they've been taking their pain medicine for 10 years now, and they're severely addicted, and they don't even realize. But they absolutely are. There's no way they could just stop taking them one day. But it's gotten to the point now where America takes 50% of all the pharmaceutical drugs on planet Earth, and we are a little over 3% of the world's population. So I'm not saying that in an acute situation that pain medication might not be necessary, but for the long term, study after study shows that it really can be damaging in the long run. So our protocols are designed to get the joints functioning correctly, slow or stop the rate of degeneration, and eliminate the pain naturally. So I'm hosting a free community workshop called 5 Secrets to Ending Your Pain for Good. It's going to be February the 21st at 7 p.m. at the Hilton Garden Inn. If you have any type of pain whatsoever, chronic pain, it can be acute disc, sciatica, stenosis, arthritis, any of these labels that you've been given, this workshop is going to show you new technologies that just may be able to help you. There are some amazing new advancements that have come out in the last few years that you may not have even know exists. So the workshop's going to be February 21st at 7 p.m. at the Hilton Garden Inn. If you want in, you need to call now because this one's going to fill up quickly. Obviously, we're not in the office today. It's Saturday morning, but just leave your name on the machine and we'll call you back Monday to schedule your appointment. It's 837-7174 in Lafayette. That's 837-7174, or you can simply text the word pain to 77453 right now. That's pain to 77453. Your number will pop right up on my computer Monday. We can give you a call, book your seat, and we can take it from there and give you some more information. In New Iberia, Dr. Fontenot is going to be hosting the exact same workshop. Their number is 367-2567. Or you can get all those numbers on Facebook at the Bryant Wellness Institute. Now, each participant is going to be given a $200 gift certificate that's going to cover their motion study radiography. So this amazing new exam we've been talking about, this motion study radiography, if it's applicable, you will be given a certificate to help cover that. So when we get back from break, We're going to talk a little bit more about laser technology, cold laser therapies, and I wanted to dive into that a little bit more. We touched on it last week, but we're going to get into some of these new amazing technologies right after this break. So don't go away. That number again was 837-7174. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining us today on the show. February is Spinal Health Month at Bryant Wellness, and we're calling attention to some of the amazing advancements out there for chronic spinal pain. And I don't care what you've been diagnosed with. I don't care if it's arthritis, stenosis, sciatica, degenerative joint disease, herniated disc, whatever your diagnosis or however severe you feel like your conditions are, I want you to know we're talking about solutions to these things, drug-free, surgery-free solutions all month long. And even if you've already had surgery and you're still having problems, I want you to know there are some amazing new advancements that we do at Bryant Wellness to solve these things once and for all and give you your life back. Now, remember on last week's show, we talked about decompression therapy, and we said that decompression has been shown to be one of the most effective things ever for spinal disc. And studies show that when done correctly, it can be up to 92% effective. And 2 years later, that percentage was still 86% effective. Now, I know in the first couple of segments, I was talking about that way too much has been made of the spinal disc, and it has. But that's not to say that it does not happen, because it does. But you have to handle the disc and restore function both. And that's why I was saying we use MRI and motion study radiography so that we get a complete and full picture of what's going on with the patient's structure. And remember, we talked about that a University of Cincinnati did a study to show that only 26% of patients return to a normal life after spinal surgery. So my point is, don't wait till this becomes surgical. And so last week, we went into decompression in great detail of how amazing of a treatment that can be if it is a spinal disc. And in all caps was, when done correctly. And so Dr. Fontenot and I have passed rigorous board exams on the proper application of decompression therapy. So even if you've tried decompression and it didn't work, it may have been the application of it that failed. And the next subject that I wanted to talk about today, another amazing advancement in the treatment for spinal problems, is cold laser therapy. And I touched on this last week, but I ran out of time, so I wanted to bring it up again this week. Cold laser therapy uses a non-heating laser device around the nerves, joints, and tissues. It's completely pain-free. It stimulates the nerves to heal. It improves circulation, and it enhances cellular repair. Now, this is not a hot laser. It doesn't burn you like a tattoo removal or some of these other lasers that they use like for cosmetics. It's a cold laser, meaning it's not it's not a high enough force to heat up. It's just below that level. And some of the benefits, according to the research, of the known biological effects of laser therapy, according to all the clinical studies and trials on the beneficial effects of cold laser therapy on the tissues, they found that, number one, it accelerates tissue repair and cell growth. Now, that would be great for any damaged tissue. If we could accelerate the tissue repair and the cell growth in that damaged area of your body. Now, keep in mind, no matter what actually damaged is in the spine, if you could get it to repair and heal better, then you're going to heal faster. So if you have a torn muscle, if you have scar tissue, any of that stuff, we can improve the cellular repair rate, and that's always a good thing. It reduces fibrous tissues and scar tissue formation. And that's really a big deal, guys, because fibrous tissue or scar tissue is a real problem with the spine. Almost every single spinal case that I've looked at over the last 20 years, and I think that's been over 10,000 patients now, over the last 20 years, almost every single one of them, one of the common things that they have is scar tissue. And that's also called fibrous tissue or fibrous adhesions. Now, this is a really big deal, guys, because fibrous tissue or scar tissue is very painful. So what happens over time, if you remember, we talked about these 1,000 little physical traumas in your spine that you've never had anything done for. So the problem is you lift something a little bit wrong or you twist yourself a little bit wrong and you create these micro tears in the tissues. And this is a situation where you're sore for a couple of days and then it gets better. Maybe you were lifting groceries out of the car and you pulled your back a little bit and it got sore for a few days and then it got better. Here's the problem with that. It creates a micro tear and that little small wound will form and heal back as scar tissue. So if you look at your collagen fibers under a microscope, collagen fibers are what your soft tissue is made from. It makes up the tendons and ligaments of your body. And if you look at collagen fibers, healthy collagen fibers under a microscope, they're going to be all running parallel like an interstate highway. All of the collagen fibers are nice and lined up in healthy tissue. Now, after that tissue gets a tear in it, and if you were to look at those same collagen fibers under a microscope, now it's going to look like a mishmash of netting or webbing. Those collagen fibers are going to be crisscrossed and intermingled. It's going to look like a wadded up fishnet, like a tangled up netting. And you can feel these under the skin as a marble or a little tough ball under the tissue. So if you will feel around your painful area and you feel these little marbles underneath the skin or these little fibrous adhesions, these are full of pain fibers. And they're a very, very big problem whenever it comes to treating a patient with chronic spine pain or really chronic pain anywhere in the body. You can have these in your shoulders, in your knee. Fibrous adhesions, guys, are a huge source of pain, probably one of the biggest. Cold laser therapy breaks those down and allows them to soften up. Now, another really amazing treatment that we have for scar tissues or for fibrous adhesions is something we call rapid release. Rapid release is a new technology that's specifically designed to break down scar tissue and break down fibrous adhesions. And those are one of the main factors that causes spinal pain when no other doctor or no other professional can figure out why you're hurting. It's almost always fibrous adhesions and scar tissue. So if you've been to doctor after doctor, nobody can figure out what's going on. Almost 100% of the time I've seen in the last 20 years is that this patient is just eaten up with scar tissue and fibrous adhesions. And we have two very effective ways to break those down. We have rapid release and we have cold laser. Now, the third benefit of cold laser is that it improves vascular activity, meaning that it brings more blood flow to the damaged area. Blood equals oxygen equals healing. So the more oxygen we can get to the damaged tissue, the softer and healthier and better it's going to be. So cold laser does a lot of amazing things to stimulate tissue repair, decrease fibrous adhesion and scar tissue, oxygenate the tissues around it, speeding up the healing process, and it's completely pain-free. So since I brought up this rapid release, let me just explain a little bit more about how that works. Rapid release works on the principle of frequency. Everything vibrates at a certain frequency. You know, we've all seen the picture of the wine glass that they break with a musical note. You know, they sit it in front of a speaker and they play a musical note and the wine glass breaks. We've all seen that. Now, if the note that is played doesn't match the frequency at which that glass vibrates, no matter how loud it is, it won't break. No, you have to match the frequency of the musical note to the frequency at which that glass vibrates in order to break it. Now, with rapid release, it matches the frequency at which breaks down these fibrous adhesions or scar tissues. So 2 or 3 minutes of rubbing over these fibrous adhesions with this rapid release, and it softens these collagen fibers and allows them to line back up the way that they're supposed to, like I was saying, like an interstate highway. And we can reduce these extremely painful fibrous adhesions using rapid release and also using cold laser therapy. And these are two really amazing technologies, even for something like failed back surgery, because there's not a lot you can do once you have plates and screws in there or you have fusions in there other than do things like work on the scar tissue, work on softening of the flexibility of all the tissues around the surgery. And that helps those patients tremendously. So once it's fused, you can't restore function, but there's lots of other things that could be done. And in most cases, even patients that have had surgery that are still hurting, we can get some tremendous results using some of this new technology. And the last thing that I wanted to say before this next break, and I'm throwing a lot of ideas out there at you guys, but I'm just going over some possibilities of technologies that we have that might be able to help you. And when we sit down with every patient, we figure out what's going on with them, what will be effective, and what we can do to help them and not. And we develop a comprehensive strategy for those things. So all I'm doing today is just throwing out some possibilities. And so we're not saying that all of these things are going to help you or because we don't know that. But we sit down with every patient in a very precise manner, and we figure out a comprehensive strategy to solve what their individual condition is. Because I've seen over 10,000 patients and never two just alike. Now, here's the thing. If I do 5 things and each one of them just helps you 20%, you're 100% better. So we don't have to find the magic bullet because there's not one. And this is the mistake that I see people make. They'll try one thing, it'll help them a little bit, so they stop. They try the next thing, only helps them a little bit, so they stop. If I put 5 things together as a comprehensive strategy, and each one of them helps you 20%, and we do those in a very common sense order, we can make profound changes in your body. Let's say that I do 5 things, and one of them, I completely missed the boat. Like I was just out of left field. It didn't help you at all. But the other 4 help you 20%. You're 80% better. 80% less pain. 80% better function than when we started. And I don't think too many of you out there would complain about being 80% better. So if I do 5 things and we just get a pretty decent result out of each one, guys, we're all the way there. And that's the way this works, dealing with these complicated spinal disorders. It's not one thing. It's a strategy. It's a comprehensive strategy to solve it. So I'm hosting a free community workshop to tell you about each of these things. And I want to invite all of you guys to come. It'll be February the 21st at the Hilton Garden Inn at 7 p.m. If you'd like to register, you can call my office at 837-7174 and come hear about all of these different technologies and see them in action. The number's 837-7174. In New Iberia, their number's 367-2567, or you can simply text the word pain to 77453, and your number will pop right up on my computer screen. Our staff will call you back Monday to register you and reserve your seat. The number's 837-7174. And when we get back from break, I want to close today by telling you another amazing treatment that you probably have never heard of. So stay tuned right after this short break. And that number again is 837-7174. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining us. February is Spinal Health Month at Bryant Wellness, and I have one more technology on the table before we close today that I wanted to discuss with you, and that is dry needling. Now, personally, I would have named it something different. I think if you ask somebody on the street, hey, do you want to be dry needled? I don't think you would get very many yeses, but basically that's what this is what it means. When the body goes into pain, so let's ask ourselves, What is the difference between acute pain and chronic pain? Why, when I hit my elbow, it hurts for a minute and stops? And then why does other areas go into chronic pain? Why does the body get stuck in this loop of chronic pain? Here's what happens. Now, when an area of the body starts to go into pain, the body has a protective reflex mechanism called splinting, which basically means that it tightens up all the muscles and tissues around an area to protect it. That's where all the muscle spasm and tight tissue comes from around a painful area. That's a protective mechanism called splinting. Now, here's the problem with that. Sometimes the body overreacts and it can splint the area too tight around that painful area. And when that happens, it pushes the blood flow and circulation out. But here's the problem. The blood is what contains all the oxygen that area needs to feel better and to heal. So it hurts worse. So it contracts harder on itself. So it pushes more blood flow out so that it becomes more painful. And now it contracts even harder. And now you're in this downward spiral of muscle spasm, contraction, chronic pain, and loss of improvement. And this is by definition, this chronic pain loop that we talked about. Now, the question becomes, how do we break that cycle? Well, if I take a tiny acupuncture needle and I start to insert around all of these spasmed areas, it breaks this cycle. All of a sudden, the body's defense mechanism goes into overdrive and it rushes blood into these areas. It opens the blood vessels. It washes out the waste products. It brings oxygen and nutrition deep into these chronic pain areas. So it really reverses and breaks this cycle of pain, spasm, and splinting. Now the body can all of a sudden heal. And I have seen some astonishing results with chronic pain patients. I've had patients literally stand up and start crying the results they had, just how fast this works sometimes. So this, in some cases, is absolutely amazing. Now, for those of you that are afraid of needles, these things are about the width of the human hair. They're tiny. They're about the third of the size of a mosquito bite. So you don't have to worry. If you're in pain, it's definitely worth the trade-off. Now, I want you guys to understand that the human body is so complicated. Figuring out solutions to these complex type disorders takes some time. You can't be lazy or in a hurry. You can't figure this out in a 3-minute office visit. You have to be willing to sit down with the patient, track their spinal health all the way through their background, through their entire life, and find out how it was damaged, how it's functioning, and what we can do to restore function once and for all. And you have to be willing to sit down with the patient and put in the time. You have to be willing to help the person, and that just takes a little bit of effort to figure out what has been damaged and what we can do in order to put it back together. So the workshop's going to be February 21st, 7 p.m. at the Hilton Garden Inn, right across from the Cajun Dome. I want you all to know you're all invited. It'll be the best hour that you've ever spent for as far as spinal health goes. We're going to talk about simple things you can do at home to stay healthy. The reason that your spine may develop arthritis. I'm going to show you samples of these motion study radiographies. It's going to blow your mind. And then we'll go through things like the decompression, the cold laser therapy, and I'll show you some research on each one of these things. And then everybody that comes will be given a $200 certificate to cover a wellness screening, if it's applicable, to cover a wellness screening in our office to see if I'm able to help you. And it'll even cover those motion study radiography if it's applicable. The number's 837-7174. That's my office number. Just leave your name and number on the machine. And when we get back Monday, we'll call and register for you for the workshop. It's 837-7174, or you can simply text the word pain to 77453, PAIN to 77453, and your number will pop right up on my computer. And in New Iberia, Dr. Fontenot is going to be hosting the exact same workshop. His number is 367-2567. I want to encourage all of you to join us on our Facebook show. I host a show there every Thursday at lunch on our Bryant Wellness Institute Facebook page called Dr. Kevin Live and Online. It's interactive. You can ask questions. They pop right up on the screen. That's Thursdays at lunch on our Facebook page at the Bryant Wellness Institute. And once again, that number to call and register is 837-7174 or text the word pain to 77453. Thank you guys for joining us. Have a good weekend. We'll talk soon.